Hello, this is Dr. David Green with the California Pain Network, where we connect those in pain with pain management doctors throughout the state. Today the topic is radiofrequency ablation. What is it in pain management? Well, when you hear the term radiofrequency ablation, you might hear it as other terms as well. RFA, radiofrequency neurotomy, medial branch neurotomy, rhizotomy. There's a lot of different terms that mean the same thing. But what it amounts to is the most revolutionary pain management procedure of the 21st century. Why do I say that? Well, there's other procedures that pain management doctors do that have been great. For 60 years, they've been doing epidural steroid injections. They work well, they give a lot of pain relief, they can help patients avoid surgery. Medial branch blocks have been very, very helpful, along with facet joint injections. They're very helpful, but a radiofrequency ablation can provide pain relief for over 12 to 18 months, consistently, meaning a much reduced need for pain medication, increased ability to function, do recreational activities. It's just been an unbelievable type of procedure because the risk profile is very low. So let's look at what we're talking about. So this is the lumbar spine, okay? There's your sacrum here. This is your iliac wings, your pelvis, okay? So these joints here, bing, 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 they're on both sides. They're about the size of a thumbnail, and they're called the facet joints, F-A-C-E-T, okay? They're small, granted. They have cartilage just like your hip or your knee, but they see a lot of stress. Every time you bend, rotate, you're working your facet joints. So even though they're small, like the size of a thumbnail, they can be very painful, okay? So what are the treatments for it? Well, you can do steroid injections into these joints, and that can give pain relief for months. There's also a procedure called a medial branch block that puts numbing medicine above and below the joint to sort of deaden the little tiny nerve branches that are taking sensation from the joint and causing pain. Well, let's say you get a medial branch block. It works for a few weeks to a few months, and then it wears off. Well, the next step is often a radiofrequency ablation, which is where a pain doctor will put needle below and above, and they numb the heck out of your skin and soft tissues, okay? So it's a very tolerable procedure. And then they'll basically provide heat, thermal ablation, thermal energy to the area above and below, and it can kill those nerve branches for 12 to 18 months, okay? And it can really give dramatic pain relief. Now, what's the benefit of it? Well, if you have arthritis in one of these joints, most likely you have it in multiple. What are you going to do? Fuse the whole 3 levels? That's not a good idea, okay? So non-operatively, an outpatient procedure that can give you 12 to 18 months of relief is a radiofrequency ablation. You could have it on both sides, okay? It can give you relief at multiple levels where you have arthritis. It really has been revolutionary for both neck pain and back pain and even the mid-back. And now it's actually being performed with good results for this area here, the sacroiliac joint. Okay, you have 2 of those, okay? They're also doing it for occipital, up in the neck area, doing pulsed radiofrequency ablation to relieve the pain from migraines, okay? So it's been very helpful for the neck and the low back. And studies also show that you can have it repeated if the little nerve endings grow back. It can be repeated with the same results. Another, 12 to 18 months. So it's been great, okay? The California Pain Network works with pain doctors throughout the state and helps connect you with the best treatment in your area. For instance, in Southern California alone, we have over 20 doctors in over 20 locations. And that includes Inland Empire, Los Angeles, Beverly Hills, Santa Monica, Orange County, Long Beach, Fresno, Bakersfield, San Diego, and everything in between. We have a ton of doctors. They take all PPOs, Medicare, personal injury liens, workers' compensation, and self-pay. Check out our main website today at painmanagementlosAngeles.com. And if you live in one of the other areas, just call the number and we'll get you squared away with a location close to you. I'm Dr. David Green with California Pain Network. Your pain stops here.